So what are important prostate cancer treatment dangers? In this video, you will learn that many treatment benefits are exaggerated and many treatment complications are minimized. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about medical truths and patient empowerment. By the way, HEALTHdrum provides material for educational and informational purposes only and is not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. And if you like to get fact-based healthcare information, please hit the subscribe button for me. Okay, so let's get into it and start sorting out medical fact from medical fiction. So before we drill down into the treatment dangers, let's examine some prostate cancer truths. So this screenshot lists some very important prostate cancer truths. Most prostate cancers are outlived. Most prostate cancers grow very slowly. Most men die with prostate cancer and not from it. Most prostate cancers are not life-threatening, and prostate cancer is commonly overdetected and overtreated, exposing countless men to health dangers. So why is there such a mismatch between the claims about benefits for PSA testing and the testing and treatment harms? So let's drill down on some more prostate cancer truths. Prostate cancers are not all equal or the same. Most are not life-threatening. Most have very sluggish growth rates, taking 40 years plus from the time of mutation to reach about 1 centimeter or half an inch in size. The grade 3 in the Gleason 6 is a bogus cancer, yet despite the Gleason 6 lacking the hallmarks of cancer and physicians being fully aware of this fact, they have chosen to continue to mislabel the Gleason 6 as cancer. Only some 10 to 15% of prostate cancers are high grade and potentially dangerous, yet all patients are tested and treated as if their disease is life-threatening, when for most this is simply not the case. Most prostate cancers are outlived, so why are there so many treatment options, and what are their central dangers? So this is a list of some of the well-known core dangers of prostate cancer care. These are well known by urologists. Testing invariably leads to overdetection of insignificant cancers. Detection leads to overtreatment of insignificant cancers. Most prostate cancers do not need detection. Most prostate cancers do not need treatment. And most prostate cancer guidelines or protocols are undependable. And it's been well recorded that treatment harms reduce quality of life without extending life. Additionally, the prostate cancer narrative is financially driven, and the prostate cancer industry heavily supports prostate cancer awareness groups to drive industry messaging. So what are some of the common treatment harms associated with prostate cancer surgery, whether open or robotic? So here's a list of some of the many recognized complications associated with open or robotic prostate cancer surgery. Urinary destruction with urinary incontinence or leakage, often requiring pads or devices. Stress incontinence, which is leakage that happens when coughing or undertaking physical activity such as lifting. Then there's bladder neck contracture and urethral strictures or scarring. As well, erectile dysfunction is extremely common, even with so-called nerve-sparing techniques. Then there's the problems of infertility, loss of ejaculation, and reduced orgasm. As well, there's penile shortening as a consequence of prostate removal. And there are many associated surgical risks such as bleeding requiring transfusions, rectal injury, pelvic nerve injury, ureteral injury, blood clots, infection, and anesthesia complications. As well, there's the problems of incomplete removal or positive margins in some 11 to 48% of patients, meaning the surgery was not successful and not curative. And many of these treatments for complications may need to be repeated or undergo treatment of their complications. What about the dangers associated with radiation treatments for prostate cancer? Radiation therapy, whether external beam, brachytherapy, or proton beam, are also associated with many potential complications. This includes urinary tract damage as a consequence of radiation cystitis, which can produce bleeding, urgency, and frequency, as well as urethral strictures that also may require treatment. Commonly, their sexual function decline, often worsening over years. There's a possibility of bowel and rectal damage from radiation proctitis, with pain, bleeding, diarrhea, and chronic bowel dysfunction. And rarely, a radiation-induced fistula or an opening between the bowel and urinary system may be created. Also, there's a small risk of secondary bladder or rectal cancer developing some years after radiation treatment. Many of these complications require treatment themselves. Worse still, some 20 to 50% of patients will have a biochemical recurrence or rising PSA within 10 years of treatment, meaning they are not cured. So androgen deprivation therapy or testosterone suppression is commonly administered along with radiation treatments or at a later stage should there be a rising PSA. What are all the complications associated with testosterone suppression? So hormonal therapy is often framed as just a medication, but its effects are profound. It commonly leads to physical damage involving muscle loss, fatigue, weakness, weight gain, metabolic syndrome, diabetes, osteoporosis, and fractures. Then there's sexual and emotional damage, loss of libido and erectile dysfunction, emotional blunting, depression, cognitive decline, hot flashes, hair loss, breast enlargement, and sleep disturbances. As well, there's a long-term systemic risk with increased cardiovascular risk, including increased risk for heart attack and strokes, and a profound reduction in overall quality of life. So many patients wind up having surgery, radiation, and testosterone suppression. So what are the dangers of this combination therapy? So a lot of men entering the prostate cancer arena will be given surgery plus radiation plus androgen deprivation therapy or testosterone suppression, multiplying the potential complications. The dangers include all the potential surgical complications, all the potential radiation complications, all the potential testosterone suppression complications, along with a profound reduction in quality of life and without long-term evidence of life extension. The bottom line is that commonly the health dangers associated with these many treatments outweigh the health benefits, and for many, these complications are not only life-altering, but will remain with them lifelong. What about focal prostate cancer therapy? Are there any dangers associated with this treatment option? Not only are there various treatment options for prostate cancer, but within focal therapy, there are several options, including HIFU, or high-intensity focused ultrasound, cryo or cryoablation or freezing, TULSA or transurethral ultrasound ablation, and then there's PDT or photodynamic therapy, and focal brachytherapy or focal seeds. All of these have their physician proponents, and their benefits are mostly exaggerated. The dangers of focal therapy include mistargeting and treating the wrong area, so the prostate cancer is often multifocal, and treating one zone leaves other cancers untouched. Also, the MRI and biopsies cannot reliably map every cancer in the prostate. As a consequence, many men need repeat focal therapy, treatment, or transition to another form of treatment. Long-term cancer control is limited or weak. As well, there are the usual functional complications, including erectile dysfunction, urinary symptoms, frequency, urgency, problems with ejaculation, and urethral strictures or urethral scarring as well. There may be some perineal pain, and most studies concerning focal therapy have very short follow-up periods, and the results often originate from industry-funded centers, and safety and cure claims are frequently exaggerated. So active surveillance or monitoring of the prostate cancer is often the safest option for men, but is that risk-free? So active surveillance is often the safest option for most men diagnosed with prostate cancer, but it is not risk-free. There's a psychological burden with anxiety about cancer, the fear of progression, the idea of living with cancer, which causes stress, and many men leave active surveillance prematurely due to emotional reasons rather than medical necessity, bringing a cumulative risk of infection, bleeding, and sepsis. Additionally, MRIs can mislead, missing some cancers while overcalling others, and a small percentage of men labeled low risk may actually harbor higher grade cancer that was missed initially. There are also financial burdens associated with repeat evaluations and for MRIs and biopsies, PSAs, and visits to the doctor. Many men will transition to whole gland treatments and suffer from their many potential complications. All in all, prostate cancer is associated with many testing and screening errors, health dangers, and very questionable benefits. So you've learned about the many dangers associated with prostate cancer treatments, but what about testing and screening dangers? So PSA-based screening is associated with many inaccuracies and health dangers. The PSA is not cancer or prostate specific. It is associated with about a 78% false positive rate. The PSA limits of normal are arbitrary and made up. A high PSA doesn't mean cancer, and a low PSA does not mean no cancer. Many situations can raise the PSA artificially, and several medications can lower the PSA. Importantly, the PSA or prostate-specific antigen is a highly unreliable screening test for prostate cancer. What about prostate MRIs? Are there any concerns here? So prostate MRIs are associated with significant risks. The PIRAD scoring or MRI classification system of prostate cancer is complex and subjective. Radiologists can miss significant cancers because they can escape detection by being too small or being in areas of the prostate where they are unlikely to be detected. As well, observer error is common, and variation in diagnosis between radiologists is also common. And imaging is often combined with unnecessary random prostate needle biopsies, increasing risks. And prostate cancer MRI screening commonly does not need to be done with contrast. Non-contrast MRIs are absolutely adequate for most prostate cancer screenings. What about prostate needle biopsies? They sound routine, but are they risk-free? So the prostate needle biopsy is associated with significant health dangers that include infection and sepsis, bleeding from the rectum, urine, or semen, pain, erectile dysfunction, and a very gross sampling error, since when the volume of the 12 needle cores is measured against the volume of the prostate, the biopsy samples only about 0.1% of the prostate. As well, it's important to realize that 80 to 90% of all prostate cancers are multifocal, meaning that the cancer is in 2 or more areas of the prostate. So after learning about all the many dangers in the prostate cancer arena, what are some of the testing and treatment truths about prostate cancer? So here are some facts about prostate cancer that men deserve to know. Most prostate cancers are outlived. Most prostate cancers do not need detection or treatment. Prostate cancer treatments are associated with many life-altering and commonly permanent health dangers. Prostate cancer screening fails to save significant numbers of lives, and at about 20 years, treated and untreated patients have similar survival rates, except untreated patients avoided all the complications common after treatments. So what's the bottom line? The greatest danger in the prostate cancer arena is not the cancer itself, but in the testing and treatments of this disease. Finally, we can protect patients by ensuring that all healthcare recommendations are supported only by irrefutable and reproducible data for safety and benefits. So let's recap. In this video, what are important prostate cancer treatment dangers? You learned that all prostate cancer treatments are associated with many potential health dangers, which are commonly life-altering and permanent. And these include surgical risks, urinary destruction, sexual destruction, and hormonal therapy dangers. And with combination therapies, you simply multiply all these dangers. In fact, the current prostate cancer narrative is both fear-driven and financially driven without hard data for life extension. The current system is not supported by irrefutable and reproducible data. Instead, it consistently overdiagnoses, overtreats, and harms men in the name of standard of care. To learn more about routine medical conditions, self-care, and digital health, check out these other videos, and if you like them, please share them with your friends.